Okay, hi, it's Dr. Buford. We're just getting started on the right knee here. We've already gotten two nice hamstring tendon grafts for you. They size out to about a 7, so we're going to add a Biobrace implant to them and make it an overall size 8 graft for you. Of course, you have a little petite knee, so that should be good. And now we're looking at this medial meniscus. This is the posterior horn. Table down just a little bit, please. And so far, it looks pretty good. We didn't see any meniscal tears, that's great, on the MRI scan, but we always confirm. That instrument you see that's spinning around is a shaver. It has a little suction attached to it. And right now, we're just using it to irrigate the knee, make sure that we can have a clear picture. The articular surfaces above and below, on the femur above and the tibia below, both look good. So we'll keep looking here, but so far this medial compartment actually looks pretty good. Okay, so this is your what we call your notch. This is where the ACL is torn, and you can see how, even though you have a complete tear, there's still some fibers here at the tibial side. But when we investigate a little bit in a little bit more detail, and especially when we examine your knee, there's no stability. So it's not just how it appears on an MRI scan. You've got what we call this empty lateral wall sign, even though there's tissue running all the way up. And so sometimes on MRI, that can be a little bit deceiving into thinking that there's been some healing or that the ACL is intact, when in fact it actually is providing no stability at all. So we're going to go ahead and take out the remaining kind of scar tissue that's left. We'll show you some more in just a minute. We're going to make space here to put in the new graft. Okay, so this is the lateral compartment. This looks pretty good also. We're just, again, irrigating out the knee so we can get a good picture. I don't see any significant tearing in the meniscus, but we haven't had our best look yet. But certainly so far so good. Push down on the knee if you can. Okay, hold on, relax. I need to bend, the knees come straight again. Okay, so we'll show you some more in a little bit, but this looks great. The next thing we'll show you will be the patellofemoral compartment. There's a little bit of a kind of beginnings of a split on the superior border of the meniscus, but it's partial and it doesn't require repair. And as we look at it here, we can confirm that. Can you go up on the brightness a little bit? Great. Yeah, I think that's going to do just fine. So next we'll look at the patellofemoral compartment. Pause. Okay, recording. Okay, so this is your kneecap or your patella at the top of the screen. It looks pretty good. This is the trochlea that the patella glides in when you flex and extend your knee. And it also looks pretty good. No signs of any significant arthritis. There's a little bit of the ligamentum left that we're going to remove just so we can see better. There we go. Okay, so that looks great. So we're going to get to work now on making some good tunnels for your anterior cruciate ligament. Go up to 60 for a minute. Okay, so we've got the new graft in position. Hold the camera right there. We've augmented the graft, your ACL graft, with an implant called Biobrace. It's just an absorbable kind of a scaffold that makes the graft a bit stronger from the very beginning and then ultimately goes away over time. And that's what you can see here. You can see the Biobrace on the outside of the hamstring tendons there. Okay, and so as we straighten and then bend back with your knee, that looks good. So we're going to go ahead and fix this on the tibial side, and then we're going to get you back to the recovery room. So good luck to you now. Bye-bye.